The homeless and the incarcerated are alike in a number of ways. Both suffer high incidence of mental disorders, high degree of overlap between the two groups, and services are mandated for the incarcerated but not for the homeless. The homeless. Four main factors contribute: deinstitutionalization, loss of casual and non-skilled employment opportunities, loss of short-term housing for the very poor, availability of affordable intoxicants. And the discharge planning should be shelter and mental health treatment, and then there is the clubhouse model. Now, the clubhouse model is one approach to caring for the homeless. It provides housing, employment, jobs, and social skills for people who are mentally ill and homeless. NIMBY syndrome. This is not in my backyard. American society wants homeless off the street, but does not want homeless services provided in their neighborhoods. Now, the prevalence of bloodborne pathogens in homeless persons with mental illness is strongly associated with substance abuse and injection drug use. Now, by 1980, almost every state prevented hospitals from locking up clients for more than a few days unless they pose a danger to themselves or others. The fathers of the working age are considered the unworthy poor. A discharge plan for a mentally ill and homeless patient that's being released safe from prison can be successful if the plan includes shelter and a mental health treatment. And TB is probably one of the most commonly found among the homeless. Assessment. Homeless are not a homogeneous group. Alcoholism, chemical dependency may be 50 to 70%. Evaluate at the point of care, which should include physical and mental assessment. And TB being the most common, and bloodborne pathogens strongly associated with substance abuse and IV drugs. And good questions again listed, page 531 in the nursing process. Nursing diagnosis: ineffective coping, alcoholism or chemical dependency, disturbed thought processes, disturbed sensory perception such as hallucinations, social isolation, hopelessness, powerlessness. Outcome identification: this should be individualized and it depends on diagnosis. Priority may be that the individual receives services dealing with his or her primary problem, and the outcomes, again, are individualized. Planning and interventions: stabilize mental illness, teach living skills. Patients should identify own needs and goals, maximize the patient's autonomy, chemical treatment for chemical dependency, and assist with the system trying to deal with it, and treat the patient with respect and dignity. Evaluation: now this is based on stated outcomes, so who will advocate for the homeless? Community services have been improved and due to the efforts of many caring individuals. The incarcerated: between 1980 and 1990, the number of adults on probation or parole more than doubled. Federal and state prison populations has almost tripled in the same period. 1 year in jail is equivalent to a university education. And the American Nurses Association is a major resource for nurses in providing care and direct screening services to the prisoners. Mental health needs: there are substance abuse, psychosis, personality disorders, organic disorders, depression with suicide potential, development disability. Now, mental health care for prison inmates who are psychotic is required by law. One of the biggest challenges facing the prison system is caring for those who are either psychotic or suicidal. Prisoners with serious mental health problems are usually treated by psychiatric staff within the prison system. Mental health services: individual must be a threat to theirself or others to transfer to a mental health facility. Most mental health services are provided in prisons, and city and county jails have fewer resources. Suicide risk: most important mental health concern in a prison population. It is more common in city and county facilities and may be done while they're under the influence. Inmates are considered one of the highest risk groups. Suicide risk: night admissions utilize less staff. Adolescents in adult jails may be at a higher risk and a major source of legal liability. Substance abuse and addiction: withdrawal in jail is significant risk. Alcohol and opioids are most likely substances that are used, and a nurse must be able to recognize impending withdrawal. Tremulousness, which is the shakes, acute hallucinations, and then delirium tremors, which is delirium with the shakes. Assessment. Assess the immediate need, their physical condition, and their emotional state. Nurse and diagnosis. Ineffective coping, hopelessness, risk for suicide, risk for violence, self-esteem disturbance, and social isolation. The outcome identification. It depends on the length of stay, the overall safety, the lack of information about prior health needs. An outcome is based on unique factors of the individual as well as the sentence. Planning and interventions. It is similar to those for patients outside the prison system, and it depends upon the diagnosis, and they can attend AA while in a prison setting. Evaluation is based upon outcomes, revisions in diagnosis, and care based on evaluation. Advocacy. Now, nurses are patient advocates, which involve providing additional services, shifting funds from one service to another, and political action.